Thanks to all of you for joining us this morning. A special thanks to Senator Harry Reid, who the very fact that he's taking out time to come and speak to us indicates how strongly he feels about health reform and the need to make sure children are covered. And I also want to thank my colleagues from the American Academy of Pediatrics, Dr. David Tayloe and Larry McAndrews, who's president of the National Association of Children's Hospitals and Related Institutions. And we're here today really not only because we support health reform, and obviously we do, but we're also here to say that the weight of all of the major pediatric organizations in the United States want to make sure that all of you know that it is compelling and critical that we get everyone in our country covered, and particularly our children. What many people do not quite appreciate is how many children are now left out of the system. We have approximately 21 million children and young people, this is ages 0 through age 24, who do not have health insurance and have not had it for some significant part of the last 12 months. The thing about what Senator Reid is now doing, along with his colleagues, Congresswoman Speaker Pelosi, and all of their colleagues in the Congress, is they're taking an opportunity to get this right. For the first time, we have a real opportunity, veritably at our fingertips, to make things right in America for everyone, and especially for our children. With no further ado, it is my great pleasure to introduce Senator Harry Reid, our Majority Leader.
The United Nations ranked America's health care delivery system 37th in the world, right behind Serbia. Our children die, infant mortality is extremely high. We've got to do much better than what we're doing. This is the time to act, to ensure security and stability for those with health insurance and affordable coverage for those who don't. We need to end discrimination of people who have pre-existing conditions. We need to make sure that we have free preventive care. We must do something to limit out-of-cost expenses, stop gender discrimination, eliminate annual and lifetime caps on coverage, guarantee insurance renewal. We need to prevent insurance companies from dropping coverage for those who are sick or hurt, and we need to extend coverage for young adults.
I'm here today with Dr. Redlener as a co-founder of the Children's Health Fund to be an advocate for the most vulnerable and the neediest portion of our population, poor kids. The best of our teaching tells us that after we look after our own family, we should pay attention to the family down the block who maybe recently had its wage earners become unemployed, or for the family across town that lives in poverty. I mean, these people have hearts and lungs and eyes and ears. They have the same diseases and the same ailments that afflict their more affluent neighbors. I think that by reaching out and paying attention to this group, we will become the America that I think we all aspire to be.
A lot of children in the United States depend on our extraordinary children's hospitals to help them when they really need medical help. These children's hospitals, which are in many communities around the United States, provide the final bastion of health services for those children with severe chronic illnesses and persistent problems that can't be solved in other places. They are the port of last resort for our America's kids in terms of their health care needs. So the fact that the National Association of Children's Hospitals and Related Institutions is so strongly behind health care reform tells us something very important about access to those services and why there's such need and why we have to solve those needs. And to speak on behalf of the National Association of Children's Hospitals and Related Institutions, I'd like to invite my friend Larry McAndrews to come and say a few words.
Thank you, Irwin. It's a real privilege to be amongst you today, and I think it's one of the greatest strengths that we have in the country today, that so many of you are so passionate about making sure that children have access and coverage to health care. Let me speak just a moment about children's hospitals. There are roughly 200 children's hospitals in the country. And there are about 25% of our population, give or take, are children. But only about 10% of all the health care dollars are for children and children's health care costs. And so these 200 children's hospitals, these 3% of all the hospitals in the country, provide about 40% of all the care in the country. And the children's hospitals are both ambulatory as well as inpatient. And we work very closely with the pediatric community, and it's partly why we're here today. The pediatricians that serve as the front line of caregivers for children in their communities are directly involved in the care of children also in the children's hospitals. And so it's a very small community doing a very big job for children in the country. And we all appreciate the work that Senator Reid and Speaker Nancy Pelosi have done to ensure Medicaid, to ensure S-CHIP and President Obama's support of these very vital programs. But what we also still understand is there are a number of kids that do not have access. They have coverage but no access. And part of that is that there are shortfalls in the number of pediatricians and in the number of pediatric subspecialists in the country. And a very real part of that problem is the adequacy of reimbursement and the support that's being provided to them to support their coverage. And so we are hopeful, very hopeful, that through health reform we will see these issues addressed in a very strong way so that we can assure that all children in the country have adequate coverage as well as access to the pediatricians and to the children's hospital services that they require. Because we know coverage and access really makes a difference in their outcomes, in the quality of care that they've received. And we know by improving that we will have a better future for this country and a better future for each of the children that we really love and care. When each of us think about the role and responsibilities that we have for the children that are in our own lives, we can understand directly the kind of care that we need to provide each of those children, to provide them a safe, secure environment. And as we think about that, all we need to do that for all children is to make sure that all of us are working together to provide that coverage and access that children in the country need and deserve. Thank you very much for being here, and thank you for support of health reform.
Many of you gathered here on the stage, and certainly Dr. Redlener, have dedicated their entire lives to the issue that strikes the heart of our country's future, the health of America's children. I want to acknowledge Dr. Tayloe and Larry McAndrews for their passion for our families and our nation's health, and they remain a driving force before our successful reform efforts this year. I mentioned S-CHIP, but that's been enormous progress. It's already saved lives and made kids healthier. But now we have a big opportunity to make significant progress for our children again with this health insurance reform bill. We must act to ensure stability and security for Americans with health insurance, and that means America's family. It has to be quality, it has to be affordable, and it must be accessible to all of America's families. And in that way, we will lower cost, improve quality, expand coverage to the tens of millions of people who and families who do not have health insurance, and also to ensure choice. If you like what you have, you can keep it. But let's move on to making sure our children are well served. So today we have an opportunity to transform our economy and build a foundation for prosperity for every citizen and strengthen the character of our country. It's an opportunity we cannot miss. Our country and our economy will not have to wait anymore for health insurance reform. Our families can't wait another week for us to do what is right, and our kids can't wait one more moment for us to act. Thank you, Paul Simon. Thank you, Irwin Redlener. Thank all of you for what you're doing.